Okay, I'm going to start unless I hear otherwise. Thank you.
Yeah.
Okay, good morning, everyone. Today is Tuesday, October 25th. We have convened the Board of Health for the City of New York and the New York City Department of Health and Mental Hygiene. The time is 10:04 and I'll call the meeting to order. So I'll begin and call roll. Are the following members present? Pam Breyer. No. Dr. Sixto Caro.
Aye.
Dr. Joel Foreman.
Here.
Thank you. Rosa Maria Gill. Aye. Dr. Sidney Hankerson. Dr. Mitchell Katz. Dr. Simona C. Kwan.
Here.
Gail Neowith.
Here.
Karen Redlener.
Here.
And Dr. Lynn Richardson. Okay, not here. Thank you so much. I'll be brief. Opening remarks. We're in the fall. We're entering the winter. We continue to remain vigilant on the three principal infections which we've been dealing with over the last months and years: COVID-19, more recently MPV, what was formerly called monkeypox, and more recently polio. The work of polio and its control, working backwards, is one of basic public health, community engagement, engaging providers, teachers, schools, parents, in a citywide but also targeted vaccination effort. And the results have been successful, but there's much more to do. In the 2 months since we've begun more intensive outreach to enhance administration of IPV, we've seen a citywide increase of 9% in vaccine administration from this time last year. In the zip codes with the lowest rates of 0 to 5 vaccination coverage, we've seen up to 25% increase in vaccine administration compared to this time last year. So this is all positive signs. Obviously, we want to make sure we're getting the right people, the right children vaccinated, children who either have not been vaccinated or have delayed their series, or who have otherwise had a grandfathered exception in. But this is really the boots on the ground, almost always invisible public health that we've done for generations. Not TV ads, not mass media, but really boots on the ground, tailored, culturally competent engagement with the affected communities, with leaders in the affected communities and organizations. So more to do. We will continue to surveil our wastewater, and we will continue to double down. We're working very closely with New York State Department of Health and the CDC on this effort. With MPV, things look encouraging. Our transmission has slowed dramatically. We are below 5 cases per day. At the peak of the outbreak, we were upwards of 70 to 75 cases per day, making us the epicenter of the country. Now we've seen a dramatic decline. Vaccine demand has slowed for a host of reasons. Number one, we've administered more than 150,000 shots, really an unprecedented vaccination campaign for this condition across the country. And we've expanded eligibility criteria to a PrEP model because of that demand and because of the fact that we vaccinated the highest risk folks. We remain vigilant. We do not want MPV to become endemic here in New York City. And so we'll do everything we can in terms of targeted outreach and engagement to get people who want to be vaccinated, and to educate people about the benefits. Tragically, of course, we've had our first 2 deaths due to MPV infection in New York City. Both were in severely immunosuppressed people. Every death is a tragedy. And of course, we're very encouraged by the information from the NIH of launch of a clinical trial for tecovirimat TPOXX, which is actually being done in Central Africa. So that's a really encouraging development because we want that treatment to be widely accessible. It's still under investigational use, even though New York City has done a lot of work to get people treated. Both of those cases are obviously, extraordinary tragedies. And then, of course, COVID. Our COVID transmission is certainly down from the summer and from previous months, but we've remained relatively steady, somewhere between 140 and 170 or 80 cases per 100,000. We have not seen a corresponding impact, concerning impact on hospitalization or deaths. And we have seen a continued bifurcation in terms of infections caught in the hospital versus people admitted directly for COVID-like illness or a complication directly due to COVID. That's about 40% of people. Only 40% of people who are testing positive in a hospital are actually admitted due to COVID. So this is a helpful and positive development, especially in light of the fact that we also have widespread access to treatments to keep people out of the hospital. That is to say nothing of the bivalent booster, which we're extremely focused on getting out the door and encouraging New Yorkers to get vaccinated now as we enter the fall. We have administered over 530,000 doses to date since early September. We would like to see that number increase and the pace increase. We are focusing our efforts primarily on at-risk communities and highest risk New Yorkers, working with adult daycare settings, advising nursing homes, which usually have on-site vaccination, working with our partners at the Department for the Aging, working with our DHS and DSS congregate settings. And we're also doing more to engage small business, other agencies, and of course, the considerable amount of work being done through our healthcare systems and H&H to get people vaccinated as well. So, pardon me, it's a challenging moment. Resources are obviously, emergency resources are drying up, though we have encouraging signal from the federal government that they'll continue to fund vaccination into mid 2023 before they commercialize it fully, which obviously will raise its own set of issues. We're doing a lot of media and outreach. We're also doing a lot of pop-up vaccination sites, both for flu, which we're seeing an uptick in, and COVID-19, pairing those two shots together. Lastly, I'll just leave with reports around RSV. Obviously, that's concerning. We are not seeing the same overwhelming increase in cases that they're seeing in places like Connecticut that's being reported widely, and straining ICUs and straining ERs. But we're watching very carefully. Some of this is to be expected with the fact that we are back to some semblance of normalcy in terms of movement and in terms of lack of face protection and masking restrictions. So we're messaging to parents in particular to double down on hand washing, preventive hygiene, especially for the 0 to 1 age group, which is extremely high risk when they do get RSV. So that's my update. We continue this work all the while addressing parallel needs in our mental health system in partnership with our health and hospitals and city agencies, and addressing our overdose crisis, which continues to rise. So many public health challenges. We appreciate your support as always. And I will move on to the formal part of the meeting. So let me start by approving the minutes from August 23rd. Are there any corrections to the minutes?
I want to say I did read them carefully, but I could find no substantive errors.
That's great, Joel.
Well done. Okay, thank you. So if there are no corrections, I will Can I have a motion to approve the minutes as distributed and or amended?
So move.
Second.
Second. All those in favor?
Aye.
Any opposed? Okay, very good. The minutes from August 23rd meeting are approved as distributed. So to our agenda for today, our first topic on the agenda is the notice to adopt amendments to Articles 5 and 177 of the New York City Health Code concerning tanning facilities. You may recall we have discussed this issue at prior meetings, and now we are talking about adoption of those amendments. Our presenter, once again, is Mark Horberg, Director of the Office of Radiologic Health within the Bureau of Environmental Sciences and Engineering at the Health Department. I'll turn the meeting over to Mark.
Thank you, Commissioner, and hello, members of the board. Today, we are asking the board to adopt amendments to Articles 5 and 177, which regulate indoor tanning salons. The amendments were proposed to the board on July 21st, 2022, and published in the City Record on July 29th. The amendments align a New York City Health Code with New York State law and New York State Department of Health regulations. They increase the minimum age to use a tanning machine to the age of 18, and they provide clarification to cleaning and disinfection requirements for reusable protective eyewear, pillows, and headrests. The amendments also require a health risk warning on tanning facility websites and require facility records, if maintained electronically, to be available in PDF format. We also propose to delete the tanning facility permit fee in Article 5 because the fee is now provided for in New York State regulations. Next slide, please. The notice of intention was published in the City Record on July 29th, and a public hearing was conducted. No one testified at the hearing, and no written comments were received. We haven't made any changes to the proposed amendments as published in the NOI. Next slide, please. So today we're asking the board to adopt the proposed amendments as published in the City Record. Thank you.
I feel that the amendments are very clear, and as they align with New York State, I move that we adopt the amendments.
Very good. Yes, if there are no further questions, can I have a second?
Second.
All those in favor?
Aye.
Any opposed? Okay, the motion carries for the adoption of Articles 5 and 177 of the New York City Health Code. Thank you. Okay, moving on. The next item on the agenda is the notice of adoption to amend Article 11 and Article 173 of the New York City Health Code regarding blood lead levels in children. Our presenter is Andrew Fasciano, the Acting Assistant Commissioner for the Bureau of Environmental Disease and Injury Prevention at the Health Department. I will now turn the meeting over to Andrew.
Thank you, Commissioner. Good morning, members of the board. I'm here to discuss our proposed amendments of Articles 11 and 173. Next slide, please. So a quick background on our previously slide proposal. We propose to update the blood lead action level to reflect a recently changed CDC blood lead reference value, where they lowered that value to 3.5 micrograms per deciliter. And we also, in our previous board meeting, proposed to update the lead-based paint definition to align with HPD's definition and add code provisions back in December of 2021. The lead-based paint definition was lowered to 0.5 milligrams per centimeter squared. Next slide, please. Our specific changes to health code are as follows. We are changing the blood lead action level from 5 micrograms per deciliter to 3.5 micrograms per deciliter in 1103, 1109, and 3 different sections of 173.13. We are changing the lead concentration from 1.0 milligrams per centimeter squared to 0.5 milligrams per centimeter squared in the lead-based paint definition. And because of the updated lead-based paint definition, we are removing outdated definitions of unsafe lead paint and unsafe lead paint hazards, since now they're redundant. And in addition, when preparing the NOA, we found other references to unsafe lead paint and are removing those references as well for consistency within the health code. Next slide, please. brief timeline of our notice of intention. On July 21st, the board approved our NOI to amend Articles 11 and 173 of the Health Code. The NOI was published to the New York City Record on July 29th. A public hearing was held on August 29th. No one testified at that hearing. However, we received 2 written comments. One was in favor of the proposed amendment and one was opposed. Next slide. One commenter was supportive of lowering the blood lead reference value to 3.5, while the second commenter was opposed to this change because the reference value is not health-based and is not a regulatory standard as per their comments. The department recognizes, however, that there is no identified threshold or safe level of lead in blood, and accordingly, we recommend adopting this more protective action level. And for these reasons, no changes have been made to the proposed health code amendments concerning lower the blood lead action level. Next slide, please. The second commenter also opposed redefining lead-based paint. However, this definition is lowering would be more protective for children and is also required by the ad code. And for this reason, no changes have been made to the health code amendments concerning redefining lead-based paint. Next slide, sorry. So the proposal to the board at this time is to adopt the currently proposed amendments.
Okay, can I have any questions, any follow-up from Andrew's presentation? Okay, if there are no questions, I don't see any hands raised at the moment. Can I have a motion to approve the adoption of amendments to Article 11 and Article 173 of the New York City Health Code?
So move.
Can I have a second?
Second.
Okay, so I'm told I have to read each name, so I'll just ask your name and if you can give your response. Pam Breyer. I don't think Pam's here. Sixto Caro.
Aye. Approve.
Joel Foreman.
Approve.
Rosa Gill.
Approve.
Mitch Katz.
Approve.
Simona Kwan.
Approve.
Gail Nailwith.
Approve.
And Karen Redliner.
Approve.
So great, with a vote of 7 out of 11 in favor of the motion, or 7 out of 7 votes, the motion carries. Thank you. Okay, moving on to the next item is the proposed resolution to amend Article 207 of the New York City Health Code. Our presenter is Dr. Gretchen Van Wy, the Assistant Commissioner for the Bureau of Vital Statistics and the city's registrar. I'll turn this meeting over to Dr. Van Wy.
Thank you, Commissioner. Hi, Board. I'm happy to be with you here today. Today, I'll be talking about a proposed amendment to Article 207 of the Health Code. So as background, Article 207 holds New York City's general vital statistics provisions, and Section 207.01 allows the parents or legal guardians of a minor child or the surviving parents of a deceased child to apply to the department to correct or amend the minor's birth certificate. So this includes corrections to names. Next slide, please. Now, the department annually gets about 80 of these requests on behalf of minors in the care and custody of a state social services department or a local social services agency, where the agencies are not yet the child's legal guardian, such as children in foster care. Currently, Section 207.01 does not allow the department to grant such applications when parental rights have not yet been terminated and the agencies don't have legal guardianship. Next slide, please. And without a proper name on a birth certificate, it's difficult to establish the child's identity for enrollment in services and benefits. And of course, this includes Medicaid coverage, Social Security, and the majority of cases that come to us arise when a first name was not put on the birth certificate of the child. So instead, there's something like baby boy, baby girl, male, female, or no name given. So the agencies therefore want to come to us to put the name on the birth certificate so they can connect that child to services. Next slide, please. So currently, the way the code stands now, a government social services agency must get a court order to permit us to correct the certificate on behalf of the child. Now, this adds delay and expense to an already lengthy process of placing children in foster care families. And it's also therefore a delay in accessing social services for children. Next slide, please. So that's why today the department proposes amending section 20701, subdivisions A and E of the Health Code to allow a government social services agency to submit applications to correct a birth certificate of a child placed in their care and custody by a court when a placeholder has been assigned as a first name on the original birth certificate. Okay, so the social services agency in these cases do not have legal guardianship of the child, but this will allow us to grant these name change corrections. Next slide, please. So part one of this amendment to A really just refers to a new section that we're making in the health code. It refers to that an application for amendment of a birth certificate may be made only by the person whose birth certificate is to be corrected, if such person is 18 years of age or over, or by the parents of or surviving parent of a child that is deceased, or by the legal guardian of the person whose birth certificate is to be corrected, or the new part, as noted in subdivision E of this section, if the person is under 18 years of age. Next slide, please. Okay, so here's the heart of the proposal. We want to add a new subdivision E to section 20701, and it would read, when a court of competent jurisdiction has remanded or placed a child into the care and custody of the Administration for Children's Services or an authorized government social services agency outside of the city of New York, responsible for the welfare of a child, as determined by the department, such agency may make an application for correction of a first name when none or a placeholder was provided on the original birth certificate. Next slide, please. Therefore, I ask you to approve the proposed amendments for publication to the city record. Thank you. Any questions?
Yeah, this is Gail Naywith. The proposal that you're bringing to us has an internal inconsistency that I hope you can correct for us.
Okay.
The rationale says
Gail, you're breaking
that
up.
the Office of Child and Family Services, and then the proposal says, I'm sorry, I'm out of the country and I'm doing the best I can with the internet. So hopefully you can hear me. But what I'm saying is that the proposal is not consistent. In the
Can you go off camera?
rationale,
Gail, can you
you're
go off
saying
camera,
that the
please?
child is not in the commissioner's custody, but in the proposed resolution, you're saying that Yep. Okay, can you hear me?
Yes, that's much better.
Much better.
Okay. So what I'm saying is that there's an internal inconsistency in the proposal today. The rationale says that the child is not in the commissioner's custody, but the recommendation to change the recommendation that you want to publish in the city record says that the child is.
So I can clarify. I think I see what you're pointing at. So thank you for that point. So I think what you're
assuming that these are children who are in the custody of this somehow.
I'm not hearing everything that you're saying. I'm sorry that I can't hear everything you're saying, but I'm going to say something that I think might be addressing the concern that you have, which is care and custody is not equal to guardianship. And that is one of the challenges that we've been facing. So guardianship is different from care and custody. And what we want to do is make sure that names of children can be changed when there is care and custody, but not actual legal guardianship yet.
Does that address your question, Gail?
Yeah, well, maybe I'm just confused about that. No, it doesn't. And I can really resolve it with the technical problems that I have.
Okay, so maybe if you could, we can take that back and we can review the proposal for internal consistency and
I
maybe you
have.
could share it by writing.
Is that I don't, will be parent. I'm sorry.
Yeah, we can't hear you.
Okay, let's move
Because
on.
I'm not following. I can't fix the connection, so.
Let's
Okay.
move on. Gail, why don't you submit something in writing and we can respond to it? I think Joel's hand was next, and then Karen.
Yeah, thank you, Commissioner. I think I do understand. I was just going to say to Gail, if you can type in the chat, you could send your question to us.
Oh, perfect.
I'm
Yeah.
just going to say that I appreciate how focused and narrow the proposal is just around the first name. I wasn't aware of this challenge, but it is certainly critical for children to be connected as fast as possible to these services. So if this actually enhances that, I'm all in favor. Thank you.
Okay. I just wanted to raise a question. I also agree with the need to move forward in this way. I was wondering if there is any background information on the situation with the name of the child that would be submitted with the application. You know, that okay, this child is, you know, we've been aware of this child and the name of this child was shared with us by the parent. And he's X years old and known by this in his school, whatever the kind of a little more detail about how you know the name, how the agency knows the name, and why they think it's appropriate to add that to the birth certificate at this time.
That's a wonderful question. Thank you, or a comment. Absolutely. Documentary evidence must be sufficient. ACS or the foster care agency applying on their behalf must have the corrections application completed, documentary evidence. A lot of times what we're seeing is that the child has school records that have the name they've been using, but their birth certificate was never changed. So those and other forms of documentary evidence would be reviewed.
I just think there should be some reference to that in the proposed amendment then. I think that's great.
Okay, I see what you're saying. I think the application for a correction, we intended to imply that, but we can review it, definitely.
Thank you.
I just want to echo how important this is for clarification for children to be able to get this. And I do support Karen's comment about further clarification. That would be also important.
Okay, thank you. So are we prepared to vote on this now, or do we want that clarification before we vote?
I think we can vote.
Okay, we can vote. All right, very good. So can I have a motion to approve the proposed resolution?
So move.
Can I have a second?
Second.
Okay, very good. And I'll go down the list. Sixto Caro,
Approve.
Joel Foreman,
Approve.
Rosa Gill,
Approve.
Mitch Katz. Mitch, you still there? I think Mitch has dropped off, or at least I don't see him. Moving on, Simona Kwan,
Approved.
Gail Nailwith,
Approved.
Karen Redliner.
Approve.
Lisa, with Mitch's departure, do we have quorum? We still have quorum? Because we have 6 votes affirmative.
Yep, we're good.
We're good. Okay, so the motion passes. Thank you. So our next item on the agenda is order of the commissioner to rescind the COVID-19 vaccination for participation in high-risk extracurricular activities. Our presenter is Dr. Jennifer Rosen, Director of Epidemiology and Surveillance within the Bureau of Immunization, and I'll turn it over to Dr. Rosen.
Thank you. Next slide. For background, on September 15th of 2021, the Commissioner of Health issued an order to require COVID-19 vaccination for participation in high-risk extracurricular activities in public and charter schools. And this included high school sports and other activities that involve increased exhalation, such as singing, band, orchestra, dance, cheerleading, step teams, and flag teams. On December 10th of 2021, that order was rescinded and replaced by an order of the same name that expanded the requirements to children ages 5 and older following authorization of vaccine for this age group. This was ratified by the board on December 10th. Next slide. The order was necessary to address the high level of community transmission of COVID-19 at the time, caused in part by the emergence of new and more infectious variants, and to enable children to more safely engage in school activities. The order was consistent with CDC and the New York State Department of Health guidance for schools, which recommended a higher level of precaution for high-risk sports and extracurricular activities. Next slide. Due to decreases in reported COVID-19 cases and wide availability of vaccine, the Commissioner issued an order to rescind the vaccination requirement for participation in high-risk extracurricular activities on September 20th of 2022. Next slide. Since July of 2022, reported cases in New York City have decreased. Next slide. COVID-19 vaccination rates among 13 to 17-year-old New Yorkers are high, with 92% having received at least one dose and 82% having completed their primary series. COVID-19 vaccines are now available for all school-age children, and all children aged 6 months and older are recommended to be vaccinated, and all children 5 and older are recommended to receive an updated COVID-19 bivalent booster vaccine. CDC guidance for K through 12 schools, which New York State Department of Health and New York State Department of Education encourage schools to follow, recommends vaccination for all children, but does not have separate recommendations for participation in high-risk extracurricular activities. Next slide. The proposal is to ratify the Commissioner's order rescinding the COVID-19 vaccination requirement for participation in public and charter school high-risk extracurricular activities. Thank you. Next slide.
Okay, thank you. So any questions or comments from the board? I don't see any hands. Okay, very good. So can I have a motion to ratify the order of the Commissioner to rescind the COVID-19 vaccination for participation in high-risk
So moved.
extracurricular activities? Can I have a second?
Second.
Very good. I'll go down the list. Sixto Caro,
Approve.
Joel Foreman,
Approve.
Rosa Gill, Rosa Gill.
Approve.
Very good. Mitch Katz,
Approve.
Simona Kwan,
Approve.
Gail Neowith,
Approve.
Karen Redlener.
Approve.
Okay, with the unanimous vote, the motion carries. Thank you. And our final item on the agenda is the order of the Board of Health to rescind the COVID-19 private employer vaccine requirement. I'll turn it once again over to Dr. Rosen.
Thank you. Next slide. On December 13th of 2021, the Commissioner of Health issued an order to require COVID-19 vaccination in the workplace, which required non-governmental workers to provide proof of COVID-19 vaccination. This was ratified by the board on December 13th. The order was necessary to address the high level of COVID-19 transmission within communities occurring at that time, caused in part by the emergence of new and more infectious variants, and to protect workers, clients, and customers, including those too young to be vaccinated. Next slide. Since July of 2022, reported cases in New York City have decreased, and COVID-19 vaccines are now available for everyone ages 6 months and older. Vaccination rates are high among working age New Yorkers, with 99% of adults ages 18 and older having received at least one dose of a COVID-19 vaccine and 89% having completed their primary series. About half have received at least one additional dose. Updated bivalent booster doses are now widely available and recommended to provide broader protection against variants. Removing the vaccination requirement is aligned with other recent guidance changes, including an easing of mask requirements and New York State Department of Health's decision to no longer require quarantine following an exposure, regardless of vaccination status, consistent with updated CDC guidance. Next slide. Our proposal is to rescind the Commissioner's order to require COVID-19 vaccination in the workplace, which was ratified by the Board of Health. Next slide. Thank you.
Thank you, Dr. Rosen. Can I have an motion or any questions first from the board or comments? Dr. Foreman.
Just wanted to make a brief comment. Thank you. Clearly, this is the right time to pull back, but I did want to make the comment that I think these requirements in the moment they were initially issued made a huge difference in pushing forward vaccination rates from which we are all benefiting today. And I'm grateful that the department made those changes then and has put us in a much better place. Thank you.
Thank you for your words, and we agree. Any other comments? Okay, so can I have a motion to approve the Board of Health order?
So moved.
A second?
Second.
Okay, Dr. Sixto Caro,
Approve.
Joel Foreman,
Approve.
Rosa Gill,
Approve.
Mitch Katz,
Approve.
Simona Kwan,
Approve.
Gail Nailwith,
Approve.
Karen Redlener.
Approve.
Thank you, and with unanimous vote, the motion carries. So we're closed. The agenda has been completed. Want to thank you all for your continued support, engagement in protecting the health and welfare of the city of New York. Thank you for making yourselves available. Thank you for dialing in from abroad. I know it was, despite the technical difficulties, thank you. And I wish everyone health and safety as we enter the holiday season. Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Bye-bye.
Thank you.
Bye.
Bye, everyone.